Welcome to Real Deep Stuff. We've saved your seat at the table for this conversation. We're so glad you're here. Well, we're so excited today to have you with us, Ashlee. This is Ashlee Hall from Architect Sports in Charlotte, North Carolina, and we are thrilled for you to be here today because this is a topic that is near and dear to my heart, which would be both chronic and acute pain, the mental kind of wear and tear on that, and how physical therapy plays a part in helping people get past their pain. And you are my personal physical therapist. I love you. You're my favorite one. I unfortunately have had too many surgeries that I want to count. A big shout out to you. And we are so excited to get started to talk about chronic pain, acute pain, what is physical therapy, who should do physical therapy, all of the questions about it. So all I have to do is go into a Target or Walmart and go on the pain relieving aisle, and this is this giant wall of painkillers. And then you see like the natural pain pills on TV all the time, and there's just this plethora of pain. So there's a lot of people in pain for a lot of reasons. And so let's dig into just some basics of physical therapy and the different types of pain. So welcome.
Well, thank you. I'm very happy to be here, and that was an incredible introduction. I couldn't have
Well, great. Well, let's start off with talking about the difference between acute pain and chronic pain. If you could just explain those for us.
So acute pain is something that happens, you just sprained your ankle. So acute pain is something within a couple hours, days, weeks, and really the biggest difference is chronic pain, which is anything that is 3 months or more. So that could be, again, 3 months, or it could be 10 years, 20 years. And a lot of people think the chronic pain is just the 10, 20 years and not something simple as 3 months.
Absolutely.
Yeah.
I didn't realize it was just 3 months.
It's wild. It doesn't seem that long unless you're in pain.
But I think it gets discounted, right?
Absolutely. So I think there's so many different things that play that role. And I'll say I may or may not see a little bit more chronic pain just because people think that they can, it's going to get better, it's going to go away. They try the pain medications in the aisle, all that kind of stuff. But the biggest thing with chronic pain is they've been dealing with this so long. Some people are like, I know it's not going to get better overnight. And then some people are like, I want it to get better overnight. And so with chronic pain, it just takes longer to heal. Your body's been dealing with this for a long time. And so it just takes, that might be something like your body's compensating, other things are starting to, break down in the system, if you will. But just even that one, that tissue alone or that specific issue that we have going on, it just, when it's been going on for a certain while and that tissue's just chronically damaged, if you will, it just takes a little bit longer to come back from it. And it's not that we can't come back from it, but, depending on what it's like or what's going on, it just can take a little bit longer because it's just, has changed like their life, whether that be from a surgery or something like that. But with chronic pain especially, there's a lot of people that get emotional, and sometimes it's just they're not sleeping, and that can play a huge role. Everything, especially your mental health. Yeah, so I see probably just as much acute as chronic, if not chronic more. And that, again, varies. Because, again, people don't always just, they think, oh, it'll get better. And then then they have to go and see this doc, and then they try this medication or this injection, and it's been months later, and then it's like, okay, so the difference, with chronic pain, it's not that we can't treat it. We definitely can, depending on what we got going on. It's always a team-based approach. Sometimes it just takes longer to treat.
Yes.
That's
wholeheartedly agree. Yeah, I think it's harder than the acute pain. Like when I had bunion surgery, that was pretty much,
right,
kind of by the book.
It's definitely harder because it just takes longer for multiple reasons.
It's very
whether
layered.
It's gotten worse and other things are involved, or it just takes longer for that tissue to heal. That's kind of, a lot of people aren't surprised when they hear chronic. It's just the different nuances of chronic pain. A lot of times people associate chronic pain with like opioids or, whatever it may be, like, oh, it's just not going to get better after I've seen this, that, or the other, or I got to go and see a pain management doctor. And I think some of that gets a little negative connotation. It's just like, well, this is the last resort. And I'll say, like, again, I've had pain for probably 7 years. And 1 year I was finally like, I can't take this anymore. I'm just going to start looking. And I have people in the medical world in my corner helping me find out stuff. I can't tell you how many doctors I went to before I finally found one that helped me. so I personally experienced that chronic pain, stuff like that.
Yeah.
And that's kind of, we were talking a little bit before, was don't give up. I know it's so hard. It's so hard. And then here comes, the pain with center right by the feeling center, and it's getting emotional, and it just,
yeah, for sure.
It's just a lot. And I see this all the time, but throw in lack of sleep, throw in, change in your normal routine, throw in, which then changes, your mental health. Maybe you snap at people more, maybe you're just generally unhappy and you're tired, and it's just a crazy cycle. And so getting out of that cycle just takes a little while.
So I know neither one of us are like licensed mental health counselors, but
nope.
I'm sure you feel like you're wearing that hat sometimes in your job. So would it be fair to say that with someone with chronic pain, like they almost have to mentally prepare before physically prepare to because I know I've had chronic pain for my back, for instance, an injury when I was 15, and it changed my life. And so how I do things and things like that. And so you kind of learn to just live with it and accept it. So maybe is there a mindset that's got to switch to go, I don't want to live like this anymore?
Yes, I would say yes. Sometimes, and I would dive a little bit deeper into that. I think on the reverse side of that is people don't realize that they're in that chronic area yet, and they don't realize that what it's doing to them as far as mentally, lack of sleep, all sorts of different things. Maybe they just haven't registered that yet, and then it clicks, and then they get a little emotional, and then maybe things turn on in a good way for them. And me personally, I can say I've also had chronic pain, and it did take a switch for me. I would do stuff here and there, and then I would just complain about it and just be upset about it, and then finally it just took me to be like, I can't live like this anymore. I've got to do something proactive, and which is crazy because I'm in the field, right? You wouldn't think, but we're just not the best patients ourselves. But I think you have to want to better yourself and be open to time to get there, but different avenues, different possibilities, and just I think people just don't always know what's all out there. But just know that you don't have to live that way, and there will be something out there, and just keep trying until you find it. I think that's the biggest thing.
Yeah. Would you mind sharing with us that moment between life before and life after that moment of going, I want to do something about this? Like what changed for you?
I think the biggest thing for me was sleep. I mean, I was in pain all the time, but it just seemed like it was getting worse, and then it was affecting my relationships with people. And maybe my work, no one ever knew that unless, I talked about it. No one knew I was suffering. And so you used to hear that all the time with a bunch of different things. You never know what people are struggling with. And, my boyfriend actually would, he'd get a lot of that short-tempered, just kind of not happy. And, it definitely affected us a lot that way. And I could, with my family as well. But it was just, the pain all the time was there, but just seemed like it was more like I couldn't concentrate. I couldn't do my job. But I was just always, I had to modify a lot, and just more so though the lack of sleep. I distinctly remember one day just being like, I can't live like this anymore. I've got to do something. There's no way that I can, this is it, like that I can't get better. You know what I mean?
Kind of hit a wall.
And so and obviously I'm in the field, so I have all these resources on my back, and I know that things is better. And it's not that I hadn't done anything at all in this 7 years. I did a little bit of physical therapy, which wasn't, I was in physical therapy school. I didn't have a ton of time, and it's a lot harder than you think being in that. We're all busy and stuff. It's hard to ask your coworker during your lunch break when you're, trying to decompress a little bit to work on you as another patient, that kind of thing. So it was more sporadic. So I went to a doctor here and there, but nothing where I just kept actively, just kept going for it. And I think it's obviously different for every single person. Sometimes it's you kind of go in that way, you just haven't found it. You haven't found that solution, even though you're actively fighting for that solution. And sometimes it just takes, whether someone's saying something to you or you just finally realizing that there's something that needs to be done. And for me, it was just, there was 1 year that just kept getting worse and worse and worse. It actually might have been my first year I started working. because, stress and lack of sleep, and it was just more so my relationships with people, not just the pain, that I was like, okay, something's got to change.
You can't bring your best to
I
someone
was
else.
not even close to being my best. No. And thankfully, they had seen me before at my best. So they didn't just come on like, what is, we probably wouldn't have worked out. But yeah, it was for me as much as it was for them too. So, yeah.
It's funny because chronic pain, we'll talk about in just a second about kind of some roots of that. It can be a purely physical thing, and it can be something out of, I think, emotional or mental things. And my quick physical one was how I'm working with you right now. Was I had months of this repetitive movement of my arm when exercising in the name of getting healthy and being healthy. I just wrenched my elbow with what's, I guess, called golfer's elbow, and I played golf once in my whole life, so it's not really fair.
Very common misconception.
But it got so bad that I remember my wall was, I was standing in my bathroom and I was going to brush my teeth one morning, and that particular motion of bringing the toothbrush up to my mouth or washing my face or washing my hair, that motion of that rotation of the arm, like, it would bring me to tears, and I would sit there and stare at my toothbrush and be like, I gotta brush my teeth, and this is gonna kill me.
Daunting task. Yeah.
And one day I just looked in the mirror and I thought, maybe I just need to switch hands and I'll start brushing my. I'm 52. Like, now I'm gonna start brushing my teeth with my opposite hand.
Right.
Like, the accommodation I was gonna have to make. Maybe I can wash my whole hair with one hand. And I literally looked in the mirror and was like, okay. This is ridiculous.
That all the time. People trying, when they'll come in the first day, I'm like, okay, what do we have difficulties doing? And they don't remember what they can't do because they've already learned how to modify it, by changing arms or whatever. But that's a good example for you too. Is just when it clicked. Like,
I just was like, look, if I'm going to switch arms on things that I'm doing, I've already mentioned in my intro that I'm left-handed, and I can't do much with my right hand. So I'm like, this is ridiculous. This should not be this way. I think we need to get this looked at.
Yeah.
And it's funny because I did go to my orthopedist first.
Yep.
He's a fabulous doctor. He's done wrist surgery on me, thumb surgery on me. He's helped with arthritis in my hands and my shoulder. He's a great guy. Yeah. So he walks in the office and he's like, hey, good to see you again. I'm like, I hate that you know who I am.
Sure. We've all been there.
Now, granted, it was a span of years, not months. So it's not like I hang out there every Friday. But but I appreciate that he remembered me, but I was also like, oh man, I'm noticeable. So he was talking, and the elbow thing was so bad. I came in there, I said, look, I'm a fan of natural things first. Right. I think everything has a place. There's a place for medication. There's a place for surgery, all kinds of places. But I said, I am in so much pain with this. I am actually open to a steroid shot. It wouldn't be my first one. It would be there. I've had them in other, like, shoulders and stuff, but like, and he says, well, I'm not giving you a shot today. And I was like, okay. Why?
I want pain relief. Why?
As the eyes start welling up with hot tears. And he says, because you will be worse afterwards. And this is just my personal case with me. So he says, he goes, let me break it down for you. People that work with a physical therapy, in a year from now, they're the best off. Right. People who don't do anything and let kind of the issue just resolve itself because maybe they take it easy or whatever, they're second best off. And then the people that get a steroid shot at the end of a year are actually worse off than when their pain first began.
I couldn't agree more.
Can you explain why?
I can absolutely explain why. I have a couple different answers for that. But one is people that get the shot and they feel better, then they stop doing things to make themselves better, and they're just doing the same things that brought them to that bad place to begin with. They haven't fixed anything. They just put a Band-Aid on the pain. So, a couple months down the line, here's my elbow pain creeping back up again. That's why in a year they might be right where they started. You know what I mean? And thinking that, that injection worked. So maybe they get a couple weeks of relief or something like that, and then they're like, okay, well, I went. This is what they told me to do, and now I'm feeling right back in the same place. The other people that taking time off, I'm all about that if we can't get better. But a lot of times, and we'll get into the myths with physical therapy and stuff like that, there are times for rest and there are times for load. So I think sometimes people don't want to come to therapy because they don't want someone to tell them that they can't do what they want to do. But just taking rest in general, like that could work. But again, if they won't get back into it over time, it's probably going to come right back to, which is why they're not as well off.
Yeah.
The other option of doing the therapy, if you didn't know what therapy is, we can kind of get into that a little bit as well. But we're fixing the problem. We're finding the root of the problem. Is that because we're lacking some sort of range of motion? Is that because we're having some strength deficit somewhere else? I think we're not just putting a Band-Aid on or anything like that. We're fixing the issue. And that's why you're down the line, we're still doing well because we've kind of found out what's going on. We're working out of that and then, maintaining that by making sure that doesn't come back. And then at the same time, getting you back into doing what you want to do, whether that's brush your teeth or if that's going playing golf. You know what I mean? So working you back in that versus you having to do it on your own. But just making you hopefully better than what you were like before, just so that doesn't come back.
Yeah, because I think just normal people like me who don't have like a medical or physical education background, we don't understand how intricately the body is connected. So when I had a rotator tear, I didn't know there was anything wrong with my shoulder, but wow, my bicep burned like fire all the time. And I was like, what is wrong with my bicep? And he's like, and then he put his finger right in the joint of my shoulder and I just shot out of the chair. And he's like, well, that's the problem. It's just right. I was like, oh, okay.
So referral pain. Yeah.
So we don't understand that.
Absolutely. And I will say education is, if not equally important, it's hard to say what's more important, but I would say education is such a huge part of recovery and what I do. It's just not only saying like why this is the way that it is, but how can we, make it better? How can we just, all that kind of stuff. I think education is so extremely important. And it's not, educating like textbook, this must, it's not, doesn't have to be super scientific. It's just, explaining how this can impact you and just being like, oh, okay, well, that makes sense. I think that makes a world of difference. And I don't know of anyone that would disagree with that in the physical therapy world, just that educational piece. And I think that's where some things can lack is that educational piece. I think that when something clicks with that patient, then they'll almost buy into it a little bit more, where they'll, they understand why they're coming and they're doing certain things and why this is an issue. And then that will in turn help them, progress in the future. Yes. That could, again, we could deep dive off of many different channels with all these things that we're talking about.
Well, one of my favorite quotes of all time is Schoolhouse Rocks is knowledge is power.
Yeah.
I just believe knowledge is power.
Absolutely.
And we can sit down with a physical therapist and they explain okay, well, your knee's all fired up, so we need to strengthen your quad and your calf, so they're gonna work better to make your knee. And I'm like, oh, and it really makes so much sense.
Absolutely.
Yeah.
There's a bunch of different ways that we can educate, whether it's just something simple as that, and it's just, hey, let's strengthen this up to take off the load off your knee, whether they say, oh, okay, and they understand it or not. It's sometimes they got to see it to believe it. You tend to trust what the medical professional that you're going to see, you tend to trust what they're telling you. But I think some people just need to see to believe, whether that is seeing the progress, or sometimes it's like I'll have this awesome app on my phone. I'm sure a lot of physical therapists have it on their phone that shows the muscles and bones and all that sort of stuff that I can physically show someone. Like, okay, hey, this is where our pain is. Just because our pain's here doesn't mean it's not coming from here, you talked about with that radiating pain, but just something that they can physically see. I think that sometimes just helps them understand, being able to have like a little visual something to compare to.
Absolutely. Yeah. Well, we've talked some about some examples of physical pain and what can kind of drive us to physical therapy.
Sure.
Also, there's other kinds of pain with chronic pain, and I found this really good site called curablehealth.com, and they break it down pretty easily. I think I'm a lister. I love just bullet list things, and so they mentioned some stresses, some more emotional, mental stresses, because I know this podcast, the underlining tone goes back to mental health. And I, like you talked about your 7 years of chronic pain, and
Sure.
I've had chronic pain, and it just wears the soul completely
Absolutely.
down. So some of the
Absolutely.
stresses they mentioned that we may not really quickly associate with physical pain, but is connected, would see if you would agree with past injuries, accidents, or health conditions.
Yes, absolutely.
Relationships, family and romantic.
I definitely can't disagree with that because I just said already that affected me.
Work, someone's work. Anxiety,
Absolutely.
sadness or grief.
Yeah.
Anger,
Yep.
childhood adversity,
Sure. Absolutely.
which leads into probably unresolved painful memories. PTSD,
Yeah.
social isolation or rejection. Big with COVID.
Absolutely.
Coming out of that.
Yeah. I was very nervous with all of that.
Yeah. Discrimination. So those are some of the emotional, mental stressors that can produce the right climate for physical pain, you would say. So from that says stresses from pain would be sensitized nervous system, fear, worry, and anticipation of pain. So maybe keeps people from darkening your door. Associating the pain with some catastrophic health issue. So then when we talk about the physical side in this same graphic that they had, which I think is cool, what's affected would be muscles. Yeah. Blood flow, nervous system, heart, gastrointestinal system, urinary system, and it says you may feel pain almost anywhere in the body, tingling, numbness, burning, IBS and bladder symptoms, palpitations, rapid heart rate, headaches, and migraines. So can you connect the dots between all the physical symptoms that we just, the outward show, what's happening inside?
Sure. So I think a lot of those, absolutely, all intertwined. I've seen so many different examples of that. I can't always, I mean, I might not be able to speak so much on the, the GI system, but it's not always a direct link, like, oh, I have this pain in my shoulder, I have, pain in my spleen or something. It's not always something directly linked like that. It could be, well, I'm stressed or I'm having pain, which makes me stressed out, and that's causing me to eat poorly. There could be some sort of distant link between that. I see it go both ways. So, something where, let's just talk about stress. So let's say you're stressed with your work, and well, that's just something's very hard. You've had to change your, now you work from home, and stuff is just different in general, whether that be your work setup or whatever. But let's just say we're just stressed at work. Then both men and women can definitely happen. This can happen too, but I see a lot more in women. When we get stressed, we tend to carry that in our neck and our shoulders. So that might be something simple that you start to feel that tension in your neck, but that could also then lead to headaches from getting some muscle tension, and that can just be simply from stress. Now the adverse side of that could be like, I'm already having pain, and then I'm not getting sleep, or I can't do this because something's hurting, and that can then cause stress. So I think it go both ways, of having the stress cause the pain and having the pain cause the stress.
That makes a lot of sense.
Yeah.
Yes, absolutely. What do you feel depression? What kind of a toll does depression take on the physical body, in your opinion?
So in my opinion, and I have no problem saying that I've battled depression in my past, and when I have gone through depression, I physically couldn't bring myself out of bed, and that was at my low of my low. But that could be something where, okay, yeah, you can't pull yourself out of bed, so now I'm not exercising, which provides endorphins, or I'm not, it could be a multitude of things. And again, on the other side of it is, well, I can now not do what I normally would want to do, something that relieves my stress, something that I really enjoy, or it could just be I'm not working out, so I'm not getting those endorphins. And it varies maybe in time for everyone. It could be something where I was a week of not doing my normal routine and I'm just super unhappy about it. Or, whatever, chronic pain, right? And just causing that I can't get better. I have to live like this, and just falling into that depression cycle. I tend to see more of that versus the depression then causing the pain. It's not that I haven't seen it. It's just I tend to see more of that pain causing the depression because they can't do what they want to do,
and
they feel defeated.
I could completely speak to that. And
yeah.
even though mine was birthed out of us, so I had bunion surgery, one on one foot, then one on the other. I know that some people do 2 at a time, and I wasn't that brave, so I did it one at a time.
No,
but I maybe might reconsider that because on the back end of it, I had to go through the whole recovery twice instead of once. So I remember sitting on the couch with the ice machine, the electric ice machine thing, and I'm watching literally life go by. I'm watching my family do their thing. I'm watching kids come and go from school, husband come and go from work, and joggers outside, and dog walkers, and bike riders. And I was stuck on this couch, strapped to this machine for weeks, and it was a slow recovery, and it brought me to a low, like well, I don't have a purpose anymore. No one's, I'm invisible on this planet. Like, you can go dark real quick when you lose your place.
Yeah, absolutely. And someone comes to mind with that. Actually, I had a patient a couple months ago, had knee replacement surgery, and that's just wicked recovery. And she, same thing, she was just stuck in her house, couldn't do that, this, that, or the other, and I could just see it in her demeanor. And she's a very positive and happy person, and I could just see it in her demeanor. And I said, "What's going on?" And she kind of told me, it's like, I just stuck in my house. And I'm like, "What's stopping you from?" She couldn't drive at the time either. And what's stopping you from taking an Uber and going to walk around the store to go get some lunch, or what's stopping you from doing that? And just having that conversation with her to let her know that there's no reason she can't do those things. She doesn't need to be bedridden or anything like that. I want her to get up and move around, but there are different alternatives. And she did it, and she was a completely different person the next time I saw her. Just getting out of the house, and
that is amazing.
It made, the difference I can't even explain to you.
Wow.
And I see it all the time, and it's just, again, talking to someone and having that conversation. That's kind of where you get a little bit of that, not a licensed mental, like anything like that, not a counselor or anything like that, but just listening to someone and then being able to provide some kind of easy solution that they wouldn't have ever crossed their mind, that can drastically affect their mental health.
And for someone like me, where trust is a big issue, so it's great. Everyone needs a family and friend support system. Yes. They really, really do.
Absolutely.
But when it comes to my physical health, hearing that from you to be it's okay to go do this.
Right.
You're like, okay, I don't have to be scared that I'm going to hurt myself more.
Exactly. That's what it comes down to, is they just want to know that's going to be okay.
Yes.
You know what I mean? They can tell you this, that, or the other when it comes, if your friend was telling you, hey, let's go do this, or, it's no problem, I can go do this. Well, how do you know? How do you know that I'm going to be okay?
Right.
You know what I mean?
Right. You don't know my limits. You don't know my history with this issue and all of that. So that's...
And on the, other side as well, it's not that we always know either. We could tell you to do something and it just not go as well as we have planned as well. We can't anticipate everything, but we do see it a lot, just with everything else as well. And so just knowing that, hey, you're not going to make this situation any worse. Hey, maybe you're going to be a little bit sore, but that comes back to that education, just preparing them for what to expect too. And okay, well, I didn't hurt anything. I know she said I was going to be a little sore or something like that. I think that's a good way that we can kind of be that sounding board.
Yeah. For someone who's had, I've had more than 7 surgeries, but 7 that involved recoveries.
Yeah.
And I really rely on that advice,
absolutely,
that health advice.
Right.
And I'll say to myself, going through one of the recoveries, okay, they said that this was okay if I do it they stay in the parameters of what I'm told to do, and do it like they said, and then you start feeling a little bit of hope that okay, there is an end to this.
Absolutely.
We're gonna get better. This is gonna be in the rearview mirror eventually, and having a fresh set of eyes and perspective on it is huge. She probably was like, why didn't I think of an Uber? Afterwards.
Of course. Yeah, of course.
But we just can't see out of our own cells sometimes. We just can't see the forest through the trees, I think, and for sure. And I think we can get lost in our pain and in our headspace. It's all we think about, and can't really think about ways to fix it, because you're just it's never going to end. This is never going to end.
Absolutely.
Yeah, absolutely.
I've been there personally, and I've heard it from many patients, and I'm not always the answer, but just having someone that will listen to them maybe offer something that they have not been told before. Just, again, like you kind of said, give them a little hope. Or just, something else to try. Like, okay, this isn't the last thing. Like, there's something else I can do. And sometimes that might feel daunting as well. Just trying this, that, and the other. Like, okay, I've tried everything. I don't want to keep trying things I want to fix. So.
Yep. And for me, like, I didn't want to be on another medication. I didn't want to be, prison to the pill.
Right.
And there's a place for those things when they're needed. But on a daily basis, I just wanted something that was actually going to fix my issues.
Right.
And I wouldn't have to be dependent on an outside source. And because, there's other issues. I know, like, certain foods we eat, like a sugar can create inflammation and all of that. I think, like, alcohol is dehydrating. So I know that I just think there's a lot of natural ways to address our issues. But I think physical therapy just might get undersold sometimes. And that's why we're doing this today, because, like, I'm a poster child for, like, are you kidding me? Like, in fact, when at that same doctor with my elbow, he looked at my chart and he's like, so a year ago you're in here with tennis elbow, which is I like to play tennis. I don't play tennis. Like, I got it again from repetitive exercise because I'm an overachiever, I guess. And so he puts that finger right on that spot on the elbow. He's like, does this hurt anymore? I'm like, oh, that hasn't hurt for months. I forgot I was even here for that. And that's because I went through physical therapy and it fixed it, and I moved on and forgot about it. Yeah. And that's a beautiful story.
Yeah, absolutely.
I'm like, yes.
We'll love them all to be like that.
Like, I totally forgot I'd even seen it for it. I'm like, I don't even remember when that stopped hurting,
That's awesome.
So that's awesome. So we talked about some acute pain, from all of the physical standpoints of a injury, accident, illness, whatever, surgery, and then chronic, some of the mental and emotional components that maybe we haven't thought are connected to our physical bodies. Like, could my job really be the reason why, my back is hurting? Could this relationship be affecting me adversely so much that it's now, making my body take a toll on it? Those are really important questions that I think we should all inventory ourselves and kind of trace it back. Trace back the pain. Like, when did it, when did it start? Was this, what was happening at this time? Am I kind of on the right track with that?
Yeah, so I think that happens all the time, trying to, it's not always just an injury. Sometimes pain just, or pain, injury, whatever, just kind of comes out of nowhere and just progresses. We don't always sit down and find that out within the first 5 minutes. Sometimes it just takes having conversations and just not even thinking anything of it, and for someone to connect that dot and be like, well, hold on a second, maybe this is where our issue is. Let's take a little bit deeper dive into this. I see that, more often than not with something like work, whether that's ergonomics, how your system is set up. Just maybe it changed from, okay, this is how my setup was in the office, now I'm at home. Things are different there, but it could be something simple as, well, I have to do this kind of lifting thing from my work and it's felt fine. Now I'm hurting, it hurts. But it could be something simple as, well, let's just teach you how to properly lift as well. Again, kind of going more onto the mental aspect. A lot of times people don't connect the dots there, and it's not, again, that's not my expertise. I see it a lot. I see definitely more of the pain causing than kind of opening up the door, seeing all the different stressors that it then affects, whether that results in tears or frustration. It's not that it definitely can happen from stress to then causing some other breakdown in the system, resulting in pain. It can go both ways. Yeah,
because another aspect of chronic pain could be someone who has just a lifelong health condition. It's not their fault. It is what it is, and they're living in a quasi-debilitated state, which is what you were talking about. Just one begets the other. So, like, is physical therapy good for chronic health conditions?
It can be. It depends, honestly, on what the chronic health condition is. We can't obviously treat the chronic health condition if it's something like autoimmune, cardiovascular, something like that. We can't impact that, but what we can do is impact maybe your function. So, we have trouble walking this distance, or we have trouble getting up and out of a chair, or, something like that that's progressed with, some of the side effects with whatever they have going on, we can make those functional changes and impact. And that may in turn kind of, again, help their quality of life. But we can't necessarily impact someone with MS or let's say Parkinson's disease. We can, do things to help with their function, make things a little bit easier, but we're not treating the chronic disease, if you will.
Sure thing. Yeah, got it. Yeah, for sure. So that goes back to the point of quality of life and strength and independence. I think those are things we all want.
Yes.
And whatever the pain is that got the person to your door, you helping them achieve quality life, an independent life, a strong life, that's going to improve, I think, the entire person.
1,000%. That's what it always boils down to is independence, not having to rely on someone, changing what they, want to do. And that also plays a factor in that mental aspect as well. When they don't have to see me anymore, it's a great day for them, So
you work yourself out of a job.
Yeah. There's always more. There's always more.
Well, I think we've set a real good table to talk about all the different types of pain and the causes of that. And so now we come to, okay, so maybe physical therapy could be an option. So could you describe the difference between physical therapy and physiotherapy? Is there one?
Yes and no. I mean, there are definitions out there that they're obviously, those words exist for a reason. There is a little bit of difference, but not in the way that we think. You see physiotherapy around here a little bit, but you mostly see it in Europe, Canada, Australia. You tend to hear that way more than you hear in physical therapy. They're essentially the same thing with maybe some little nuances here and there. They're pretty interchangeable. You just hear more in the United States, physical therapy.
Tomato.
Yeah.
Okay.
I would say so, just based off the country. They might have like a little bit of different definition if you were to look it up, but I would say they're pretty interchangeable.
Okay, great. Could you describe the differences between physical therapy and chiropractic?
Sure. There are a lot of different things out there that overlap a ton. I mean, chiropractors, occupational therapists, athletic trainers, acupuncture. There's just so many different things that overlap. And a lot of times people will see multiple different people at the same time. They will see a physical therapist and a chiropractor at the same time. I might give a little bit different answer than a chiropractor would give. And I think there's positives with both, and someone that might be both or be better for a certain situation. But I can't say that one's better than the other without being biased, obviously. I would say if you're having an acute problem with your back or your neck, a chiropractor might give you a better, quicker result. That tends to be more of their specialty. And it's not that physical therapists can't do the same thing. A physical therapist's concern might be more on the exercise portion and the strength portion. Like, okay, well, yeah, I can fix your pain right here. This is a problem. But how am I going to keep that? How am I going to maintain this, make this go away so you don't have to keep coming and seeing me every month? So that might be a little bit of difference. And again, I don't want to say, there might be some chiropractors out there listening like, well, that's not what it is at all. Like I don't want to have to treat these people forever either. There's different chiropractors out there. There's different physical therapists out there. We can both manipulate the spine, that cracking of your back, if you will. Just for people that don't know that word, manipulation. So, but I think it's just one thing that chiropractors do that we don't is they more often not have x-rays in their office. And a lot of times they can x-ray and stuff like that. So I would say, that's a quick thing. But I think too, a lot of times insurance companies don't always cover chiropractic health, whereas physical therapy more often than not do. So I think that's a big difference as well. Physical therapy might be more the long game, not always, and it's not, you've kind of personally experienced, like there can be some quick relief of pain, but it's more of, all right, how am I going to prevent this from coming back in the future and not just make me feel better at the time. So there's a lot of similarities, but I think it's just maybe our mindset in what's causing the issue and how am I going to fix the issue. The approach is just a little bit different, I believe. So
yeah, no, that's a great answer.
Yeah.
That's a question I've always wanted to ask.
It's a hard one to answer. I'm not gonna lie to you.
And maybe, if someone's working with their physician, they can help, say, direct one path or the other.
I've been to chiropractor. As a physical therapist, I went through the chronic pain. I tried every avenue. It's like, well, let's just try it all. And I've had great results.
We've all pretty much heard of physical therapy, but explain the difference, please, between physical therapy and occupational therapy. We hear PTOT.
Yes.
Yeah.
Okay. So another interchangeable one that can be interchangeable, that they tend to do more what's called ADLs, or activities of daily living, working on stuff like getting you to be able to brush your teeth, get dressed, stuff like that, if that makes sense. More of those, again, activities of daily living, whereas we're maybe a little bit bigger picture, if you will. We care about the whole functional thing as well, but it's not necessarily what you're doing in the house, driving, that kind of stuff. Like they tend to do more of that, and they tend to be more in the school systems as well. So kids that, if you've ever seen, a therapist or something in the school, they're more than often not a occupational therapist and not a physical therapist, although they exist as well. Yeah, so occupational therapists work on adapting or modifying stuff within, the house to make that easier for them. Whereas, again, we're more of the movement experts, trying to improve that quality of life through the whole picture. And it's not that we can't work on, like you said, you had pain brushing your teeth, and it's not that we didn't work on that as well.
Yep.
But I'm not, sitting there and watching you brush your teeth. I'm kind of...
That'd be quite boring.
Yeah. And again, there's definitely some overlap. I've been in a skilled nursing facility on, clinical when I was going through school, and they work on sit to stand stuff, getting someone out of a chair, but so do we. So there's definitely some overlap. I don't tend to help someone get dressed, like putting on clothes and all that kind of stuff, but people tell me all the time, like, hey, I have a hard time putting my arm in my jacket. Like, okay, well, why don't we make this change? Or I have that in my back of my mind, but I'm going to affect that by doing this, and then that in turn will get better, versus trying to how to modify. Yeah.
Excellent explanation. That was hard to say.
No, yeah.
That was fantastic. Yeah.
Yeah.
No,
it's a hard one to answer because there are some different overlap, but yeah.
Very good. Thank you. What are some different types of physical therapy?
Also great questions. There's different places that you would go. So I'm an outpatient physical therapist. So that is something, your typical musculoskeletal ankle sprain, post-op after surgery. I hurt my shoulder, and that kind of thing. That's just, it's not, it can be affiliated with a hospital system, but it's something that you are not staying in the hospital to do. Just you're going at home, that kind of thing. Speaking of home, there's home health. So that's where a therapist will come to your home and treat you. And there are going forward, there are different qualifying factors for you to have home health. So it's more of, you can't get up and get to, you don't have someone to take you. You can't get out of your house. You can't drive to go to physical therapy. So that might be someone, let's say, that's had a knee replacement, and sometimes, if they don't have anyone to take them, then someone will come to their house until they can go to physical therapy. So that's another option. There's acute care. So what that is within the hospital, and that's typically just like an acute injury, a short-term stay. So maybe you've gone in and you had a fall, or you've had a knee replacement. Usually those are outpatient procedures, but they can be we stay in the hospital, and someone will come and make you get up and walk around, and make sure you're safe to go home, because you can go up and down stairs that you need to be able to get in and out of the house. So acute care is more of that, a couple days, maybe a week, something like that. Then there's inpatient rehab. That is more something like you've had a spinal cord issue, you've had a stroke, something that's going to take months and months to fix. And that also has some qualifying factors. You have to receive, if I remember correctly, 2 hours of therapy a day, mixed up with a PTOT speech, but they have to be able to do that kind of stuff. But that's typically, more often than not, I guess a little bit more neuro, again, spinal cord injury, stroke, something like that. Your everyday, this hurts me, that is outpatient physical therapy, which is what I do.
Okay.
Yeah.
And if I could just a shout out, I can't remember his name at the moment, but we're home health. You mentioned that one.
Yeah.
When my mother-in-law, she was 80 and she had angiosarcoma, and that is a dreadful type of cancer.
Yeah.
And so we had to have home health come in. And she was 80, but she was always sweet on young guys.
Sure.
She just that made her day to be in the presence of what she would say is like, a handsome young man.
Yeah.
And so we had a guy coming in through home health, and you know what they did for her exercise? They danced.
Oh, I've seen, yeah.
He
absolutely.
listened to her in their the prelim interview, and she and my father-in-law just danced for 44 years, maybe longer.
Yes.
Just dancing was their thing.
Yeah.
So he picked up on that, and he would come in and just dance with her, and that was the best. It lifted her mind and
Absolutely.
her physical.
And that kind of goes on to the mental aspect as well. How big a difference doing something physically that you love can impact your mental state.
He was a gift. He was the highlight of her week. That she got to do salsa, whatever.
That's
it's really,
good to
really,
hear.
really, really fun. What a blessing.
Yeah, because the common misconception with physical therapy is, you hear all the time, physical torturers or, whatever, it's all physical therapy hurts and all that kind of stuff. It's not always like that.
No,
it's not always like that by any means.
It's not.
I think a lot of people just associate physical therapy with surgery. I go to physical therapy after I've had surgery, and that's very, without being a little blunt, that's a very old way of thinking. A lot of people just don't know that, okay, my shoulder's hurting, why don't I just go see a physical therapist? Because one, more often than not, we can get you in sooner. Two, you're more often going to come right back to me anyway. So, the doctor, they find out like, all right, we have a rotator cuff issue. Let's go to physical therapy first. Because you should always, unless it's something that you need to jump right into surgery with, you always want to do that conservative treatment first, right? It's one, more cost effective. Two, there's no guarantee that you're going to be better off after that surgery. That's always the goal. But if we can get better without it, why wouldn't we? It saves time and money, right? And pain sometimes. Yeah. So a lot of times we're cutting out that middleman, and a lot of people just don't know that we're direct access, that you can come without a doctor's referral, and that's not everyone. Medicare needs a referral. There are certain insurances like MedCost that will need a referral, but more often than not, you don't need a referral. Come to physical therapy.
I think that is absolutely like a hidden secret. I mean, all the years I've been in and out of it with different I never knew that. You were the first person to tell me that. I was like, what?
Which is crazy. I'm very passionate about that just because, one, they just don't know, but they've dealt with pain for years and they didn't need to. They didn't know it was an option, and it's sometimes thought of as the last option, whereas it shouldn't be. A lot of times people don't know what physical therapy can do. It doesn't have to be something like I had surgery or my shoulder hurts. It can be low back pain, like everything, chronic, acute, whatever. I don't really know what's going on, but this kind of hurts me. Let us do our, kind of what we call, evaluation, assessing you and determine if this is the most appropriate place for you, if you need to go see someone else. And again, typically way more cost effective and quicker. So,
love it.
And cutting out the middleman, because you might be right back in the office regardless. So,
right.
Yeah.
Oh, I love it. Oh, because I'm all about efficiency.
Yes, absolutely. Who
Both
isn't?
Money and time, for sure.
Right.
And the
That's
fact
what
that you
people
guys
care about.
Yeah, and y'all take insurance.
Yeah,
and
absolutely.
HSA. And,
Yeah, absolutely.
all that kind of stuff. That's great. So, how did you decide you wanted to be a physical therapist?
Great question. So I think my story is a little bit different than maybe some of my classmates or other people that if you ask the same question to. I originally went to school to do marine biology. All my friends growing up in high school and everything like that, they all wanted to do physical therapy. I am the only physical therapist out of everyone that said that. So
wow.
I wanted to go, I wanted to do marine biology. I quickly realized that was not for me. I had a love of oceans, all that kind of stuff. And I just realized, okay, I love the ocean, but what would I do here? I wasn't passionate about it. So I was thinking like, okay, what do I love to do? I love sports. I love physical activity. I don't want to be in a desk all day. That's just not something that excites me. I like medicine, always has, attracted me, that field, but I don't like medicine. I don't want to do all that. What can I do? So I started thinking through things. I went to physical therapy literally one visit my entire life. Not once, one bout, one day, that's the only experience I had, which was crazy for how injured I was all the time growing up. But I started to volunteer and just try a couple of different places, out just to kind of see what it was about. And I was just like, this is awesome. I love this. I love that I can make just the biggest thing that drew me in was just the impact you make on people's lives with physical activity and just how many different ways you can treat someone for the same issue. It's just not boring. Like there's just, it's kind of scary in a way. It's like, how will I ever know where, this is how to make this better. And that's actually, now looking back at it, that's the beautiful part about it is there's 100 different ways that you can treat the same issue and get the end result to be the same. So I think it's just, it keeps me on my toes, keeps me interesting, keeps me out of a desk unless I'm doing paperwork.
And then you have a standing desk.
And then I have a standing desk. So
See that?
Exactly. So people are like, "This is your desk?" I'm like, "Yeah." I had a lot of people. If you ask, they had some injury and they had some personal experience and stuff like that. And it wasn't personal experience for me. It was just what am I passionate about?
You completely bring your passion every time we meet. Like you have a sparkle in your eye. It's like you're doing what you love, and it shows. Yeah. And that really helps the patient side of it be more enthusiastic, more committed.
Sure.
Like to see your level of enthusiasm, like it's a good vibe.
When you're kind of drowning in the work, just like with any job, it always checks me back to reality when someone, like you says something like that, and someone tells me how I've impacted their life, and just how, thinking about how they were the first day they came in, and then, it's their last day, and just how much better they are. And they don't even have to tell me thank you, just like knowing that they can do something they couldn't do before, fixing a problem, and it just feels good.
Okay, so I'm gonna share a little moment that I haven't shared with you yet that has made a lasting impact, something that you did. Oh. And it actually had nothing to do with the body.
Okay.
So I was there for one of my normal sessions, and I was doing my band work like over in the corner, and you were actually working with another patient, and because you guys multitask really well with that. And I got a phone call, and I had to take it, and it was an upsetting call. Yeah. It was a business kind of call. I don't know if you remember this moment or not.
I think I do.
But so like I wasn't mad, but I was like upset. Yeah. And we're all in this one big room, and there could be like 6 therapists and at least 6 or more clients or patients in there. Yeah. And I just kind of like lost that perspective that I wasn't alone. Yeah. And I mean, I wasn't saying anything bad. I was just I was just upset. I was just like, well, what do you mean? Kind of thing. And I hung up, and you were working with someone on a table, and you like yelled across the room. You're like, "Christy, are you okay?" And I looked up at you, and I was like, "Yeah." And I was instantly like embarrassed that I didn't realize everyone could hear that. Yeah. And I thought, oh man, I'm so embarrassed. But it's what you did next that got me. You looked at me and you went, "Are you okay?" Yeah. And it was that moment of like human to human. And it wasn't like you weren't trying to socially tell me that everyone in the room heard that. Right. Like you were genuinely interested in me. And it almost made me like cry because in that phone call, the other end of that call was someone that was really trying to be very demeaning and condescending. And I felt very small at the end of that. And you just brought me like a big breath of oxygen back up to the surface above the water, got my head back up, and you were like, "Are you okay?" And it just, I knew that you like genuinely meant that.
I did. Yeah, absolutely. Yeah. I do remember that now that you're speaking. And I'm glad I'm happy that I made, that I made that impact for you. I think that's, did. And again, that makes me feel good. And it's on many different levels. I just, any way that I can make someone's day better in whatever capacity, who doesn't love that, right? Yeah. I think that's that difference with therapy, physical therapy is you create such big relationships with people, and it's not the same for every patient. I get along with almost every single one of my patients. There's the rare exception. I definitely develop maybe some deeper connections with people because we get to spend time together and talk and stuff like that. And so I am genuinely concerned, and I know how much that can impact you bringing something heavy like that in, and then you're just not there. So just kind of back to...
I had completely checked out of physical therapy at that moment with that phone call. But it was a teachable moment for me because I actually took that and I thought, I love that. Yeah. I love that sometimes the person needs to be asked twice. Yeah. And now I have implemented that in my own life. Yeah. And if someone's having a hard time, I'll say, how are you doing? And they're like, yeah, I'm fine. I'm like, how are you doing? Yeah. And so I'm like, I'm just like, copy paste what you did because it was so impactful. Because sometimes people, they might think it's just a pleasantry question. And sometimes it also might take a second ask to get it out.
That's the same thing all the time. Like, hey, how are you? Good. Like, it just it comes out real quick. You know, you don't have to think twice. And it's just that already cued response. Mm-hmm. Yeah. And part of it, you kind of, when you're first saying when I kind of, yelled across the room. And that's always because, I knew something was going on. And I hated to bring attention. I didn't want to be that like that. But I'm glad I fixed myself with but I mean, there was obviously something on your face. It was like, she's not okay. You know what I mean?
Yeah, it's not okay. No, but I was better after that because I was like, okay, and then that helped me not just disconnect the phone call, but disconnect my mind from the phone call to go, okay, now we're back to doing my band work, and
we'll deal with that later.
Yep. Yes, exactly. Yep. I'm all back in. Yep. So what? Thank you. Thank you.
Yeah, sure.
You made a huge impact, and I do say that a lot to people. I'll be like, they're like, are you okay? Yeah. I'm like, are you sure? Yeah. Yeah. And so we just need a pause in life. And there really just aren't any pauses in life anymore. It's just go, go, go. If something is not working properly on the body, it is a little scary to be like, okay, well, we're going to spend an hour focusing on that thing that you kind of, the other 23 hours a day, we want to kind of forget, ignore is there. Like, I still got this. I can do whatever. Yeah,
in terms of that chronic pain that we kind of talked about in the beginning, right? I can fix this on my own, just let it heal, that kind of thing. Whereas that's not always the best approach. But
it takes some courage and
absolutely
bravery to go, okay, I'm gonna go and we're gonna focus on the one thing I don't want to talk about right now.
Right, right. And again, that's just making that part of that is just making someone feel comfortable talking about. Educating them. I can't say that enough. The education, what's going on, what to expect, what are we going to do about it, knowing that there's an end in sight, that kind of thing. And then even explaining pain level expectations, like that's okay to be sore, it's okay for this to hurt, okay, I don't want this to hurt, just kind of talking about that. And again, we talked about that already, that misconception of physical therapy has to hurt, and that old mindset of no pain, no gain does not always apply. And sometimes it's warranted. Like, we're gonna have to go through a little pain. It is what it is. Letting people know what to expect, and letting people know there's gonna be good days. We're gonna have bad days. We're gonna have good days. And everyone thinks that with recovery, that every day gets better, and it does. But it's not this nice straight line of bad to good. We have a great picture in our office that shows this, but people think it's this nice straight line, of recovery, when really it's this squiggly line all over the place. Getting there in the end, but it's not just always rainbows and butterflies. There are definitely bad days, whether that be soreness, pain, and then there are the good days, being able to do it, and hopefully the bad days get fewer. Again, it just boils down to education and just knowing that we know what's going to get you there in the end, and then just sharing that knowledge with someone, that kind of thing too. But some people all the time are like, my elbow's just like really hurt me today, whether that be their main issue or not. They're like, I'm just going to hold on PT today. And that's the worst thing that you can do. Because one, we can modify whatever we need to. Okay, let's get you feeling better. How are we going to do that? Whether that's, okay, we keep it really, really light. We back down a lot on our exercises. We change it up to this. We hit a little bit more, manual, whether that's treatment-based approaches. Let me get you feeling better. Okay, that's not... A lot of times people just think, I gotta work, I gotta do my exercises, I'm just gonna be sore, I don't want to make this worse. We are very adaptable people, okay? So we do how you come in, what you need, and whether that be a different issue or not, that's the beauty of it, is we can change on the dime whatever we need to. But that's the misconception, is it's going to hurt. It's going to be,
Yeah.
I'm hurting. Should I come?
Yeah.
Yeah. Let me help you. That's my job.
Right.
Yeah. So, and that helps me too. Like, okay, maybe we did a little too much, or maybe let's connect the dots. Maybe we did something else, and just the combination, just the talking through it all, and then just getting you feel better. We change based off of what we need to. So I think that's also one of the best things about my job is just being able to just change things on the dime, adapting and coming up with different ways of doing different things. Like that's one of the best parts of my job is keeps things interesting.
Yeah. Who do you say would be a good candidate for PT?
Sure. Anyone with what we call musculoskeletal issues. Anything like you hurt, headache could be absolutely neck, back pain, shoulder pain, elbow, finger, wrist, hand, whatever. Whether that's chronic pain, you hurt yourself, anything like that. Nerve pain. So if I have numbness tingling down something, that's also something that we treat. We don't treat, I feel like my heart is racing or something. That's not something that we treat, but anything that you can think of, muscle, tendon, ligament, bone, all that kind of stuff, pain essentially, or you have difficulty doing things. That is all. Everyone that goes through anything like that, all candidates for physical therapy. And if they weren't, we would let them know. Yeah. Like, all right, I think this is what avenue we need to go against. And sometimes, they might have other things going on, but there's certain things that we can treat and certain things that we're like, I want you to go see this person because I might suspect something's going on, or I can't address this. We're going to focus on this, or altogether, let's go do this first. Let's get some stuff cleared, and then we can kind of move forward. So
what do you see, kind of generally speaking, the most, and like what are you treating the most, and kind of what's a timeline if someone wants to say, okay, I want to try physical therapy to help this?
So I haven't seen everything by all means. All areas, head down to the toe. I would say most commonly shoulder, knee, low back. Obviously, hip's a big one, elbow's a big one. Knees and shoulders are pretty common. I see pretty equally self-referred, like they just came in, whether it's a return patient or like they just knew about physical therapy. I see quite a few referrals. They went to a doctor first who sent them here, and I see a lot of post-op people as well. So, which is nice. It's just always, nice to have a big bunch of different things that you can treat. But body part-wise, I see, again, everything, but more often than not, knees and shoulders are pretty common. Good amount of hips, good amount of elbows, good amount of back pain.
And it's kind of too broad of a question maybe to ask, like, what could someone expect? Would this be in their physical therapy for months or weeks?
Sure. So it's not necessarily a broad question. Every single person that comes there for the first time asks that question, and I say it depends. So there's different tissue healing. Like you can expect muscle to be 2 to 4 weeks. Again, could last longer, could be quicker. Just depends on the grade. So how much of a tear, how significant that is. Again, it depends. It depends if they're post-op. Ligament tends to take a little bit longer to heal. It's very dependent. We can give you guesses. Also depends on if it's chronic or acute. We kind of talked about that. Something that's maybe more chronic is going to take a little bit longer to heal. We try to make sure we're seeing a change. So let's say you're coming in here with shoulder pain, and if we're not getting better in 4 weeks, we're not making a change, we're not progressing, then we're going to consult. Okay, maybe we get in to see a doc, let's get some imaging, something's not adding up, and then maybe it's something that we have a tear or something like that that's just not better. Typically it's not always 4 weeks. The times vary on everyone. I can give an educated guess. I am not exact, and I tend to be more on the conservative side, just telling them it can take longer, because if you tell them it should be better in 4-6 weeks and it's not, like, well, what's going wrong? You know what I mean?
Yeah.
It's all dependent on what tissue has been affected: ligament, tendon, bone, muscle, where if it's closer towards the tendon versus more in the muscle belly. Activity, lifestyle outside of what are you doing, how much are you doing, that can play a factor in that as well.
How important would you say doing the homework is in this?
That's
the hot button.
It's super important. You might see me once or twice a week. That's not enough. it's not that you need to come in more, it's that you just have to do your stuff at home. There's a reason we give you exercises. It shouldn't be daunting. And if it is, you just need to have that conversation. It's very doable, and a lot of times, especially maybe a little bit more of the kids, are like, well, I have this, that, and the other. I play soccer, Monday, Tuesday, Wednesday, Thursday, and then I have school and I have homework, and it's just kind of finding the time, like, okay, I don't need you to do it every day. You're coming in here once, or you're coming in here twice. I need you to do it 1 or 2 other times outside of here, okay? And it should take you 20 minutes. I don't need you to take an hour to do all this stuff. And just kind of putting it in perspective. We're like, okay, let's focus on these 2 or 3 things. And it's all just based off of, what it is. It's just the conversation that you have. But it is super important. Super important.
On a 1 to 10, how important?
10. 1,000%. It is super important. There's no point in, again, that's just putting on the Band-Aid situation. We're not fixing the problem. Doing it once or twice a week. We need, strength, load. We make very slow progress. And I think you would be able to tell. And we can all tell when you're not doing your exercise. I just want you to know.
Oh, snap.
We can tell. I'm not going to tell you my secrets of how we can tell, but we can. Typically, a lot of times when people aren't getting better, they're not doing their stuff. And we don't just give it to do it. There's always a reason and function behind it. And if you just don't know or want to know why, just ask.
Well, if you go back to the reason. If you go back to the knee example, like if the knee's kind of tweaking and you want to build up that quad, doing an hour in a physical therapy office once a week doesn't really build up anything.
And the hour is, we're doing multiple different things. We're doing manual treatment, whether that be soft tissue work, stretching, as mobilizing the knee, stretching the hip, whatever it may be. We're putting hands-on treatment on you. Some of it is showing, going through like, okay, I can't go up the stairs. All right, let's go look at the stairs. Let's check our mechanics. Let's check, let's make sure we're doing it correctly, and how can I help you do this better potentially. And sometimes it just boils down to strength. The strength takes time. That does not happen overnight. Mobility tends to happen a little bit quicker depending, but more often than not tends to happen a little bit quicker than strength does. Yeah. And again, it boils down to that educational piece as well. Yeah. Hopefully I answered that question. I can get off on a tangent with everything.
I recently had a conversation with someone that had been in physical therapy for a little bit, and they were like, it just doesn't work for me. Yeah. I'm a skeptic. It doesn't work. Sure. And the wife piped up and said, but how many times have you done any of the exercises at home? And he said, never. Boom. And I was like, whoa. Yeah. Come on.
So that's exactly what it boils down to is people think that, okay, well, I'm going to physical therapy, that's fixing the problem. Okay, but what we're trying to do is make sometimes lifestyle changes or maintain, or not necessarily maintain, but improve upon our strength, range of motion. And if we keep going back to doing the stuff that we were doing before, so let's say my shoulder, I'm lacking some range of motion in my shoulder's tight. Okay, well, if I do a stretch one time, a week, is that going to make a significant impact? No. That's kind of like, you might feel temporarily impactful, but how many days later, if not the next day, does it feel like it's stiff all over again? Or
kind of like eating one healthy meal a week.
That's a great example.
And then eating whatever you want the rest of the time.
That's a great example. So it's not, and a lot of times people ask, like, am I have to do this for the rest of my life? No. Again, it varies, but we kind of always give you two. When we're getting to the end or the last day, we give you a maintenance program, and we talk about how you kind of maybe titrate down. You throw in your exercise, all those kind of different things. It's different depending on the person and the goals. I think people sometimes get more like, I don't have an hour to do all this kind of stuff. And again, that just boils back down to education. But it's just having that conversation, how often they want you to do it, all that kind of stuff. It's not forever. Let's just get you in a better place first, and we'll talk about how often. But it makes a huge difference. It's not enough.
But I think showing up to the appointments and the homework is a very symbiotic relationship, because sometimes it's like, in my past, it's been like, oh, well, just come like 3 or 4 times, and then I'll just give you exercises to do at home, and you'll be fine. Which was that. No, but like this last week when I showed up, I did not realize I'd been doing some of the exercises at home wrong. Exactly. And I was just like, this one really hurts. And you're like, it's not supposed to hurt. And you're like, show me how you're doing it. And and you were like, oh, well, that's because your elbow was bent. It was supposed to be straight. And then
actually the reverse, but yes,
okay.
I do remember.
I'm glad I'm not the expert. And then the other thing was, I was using a 2-pound weight instead of a 5-pound weight. So I was like, yeah, this exercise just doesn't really do anything for me. You're like, well, it's because it's a 2-pound weight.
Right.
So like, I needed to be, corrected a little bit in how I was doing them at home.
Exactly. So a lot of it's that, making sure we're doing them correctly. So sometimes, again, people have this pain. It's like, well, okay, maybe we did too much, or maybe we're just not doing them correctly. Mm-hmm. Sometimes it's simple tweaks. Sometimes it's like, okay, we're just not ready. A lot of it too is progressive loading, which I don't think a lot of people understand, is if you're doing them correctly. And it was hard for me at the beginning when I was first starting out, like, okay, how do I know how they're going to respond to the exercise I gave them? How do I progress them? And then now it's like, okay, based off of what they looked like last time, doing stuff at home, this should be getting easier, mm-hmm. this kind of thing. And it's not always you're getting necessarily stronger in a sense of I'm gaining true muscle strength gains. Sometimes certain exercises should be getting easier. So when you should have been using the 5-pound and you're using the 2, and I'm expecting you to use the 5 and we're progressing it because, I want to, and that's how we're going to make that difference. If you're not doing it at home and I'm progressing our treatment further, it's not going to get any easier. It's not going to get any easier, and we're not going to be able to progress very much if you're not doing the stuff to help make that easier, if you will. And you could tell someone 10 times, this is exactly how I want you to do it. You turn your head for 1 second, and they've changed the exercise completely, and that's why your head is just on that swivel. And it's just, and I make this a point a lot. It's like, you should know where you should feel every single exercise, and if you don't, I haven't done my job. And again, sometimes it's just, having that conversation multiple times. Sometimes something's going to be uncomfortable. Sometimes it really shouldn't be. And that's a simple tweak of mechanics, if you will. But if you don't know where you should feel it, because let's just say we're doing something for the shoulder and you're feeling that in your upper trap, your neck. Well, that's not what we're trying to target, right? So I'm giving this exercise for a specific reason. If we're not doing it correctly, okay, that might cause more pain, or it's just not helping us improve upon the problem. So the modalities that I use might not be some of the ones that are out there. So we have dry needling. I use that a lot. Probably a little bit more than anyone else.
Okay,
I use
can I interject? Because
sure.
I am like
I probably should have started with that.
I know. I was like, ding, 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 ding. Yes. I'm an absolute huge fan of dry needling.
I am too.
And
Which is why I do it.
The relief that it gives. And I didn't tell you this. The first time that you dry needled my arm, both my elbows, I laid there and like, tears started welling up in my eyes, and all I could do was think about my dog that had passed away last April. And I'm just going, what has happened to me right now? Because there was so much activity going on in the room, and I wasn't particularly thinking about her when I came in. I am definitely, grieving her loss. I had her for 16 years. and it's a big deal. And, we do store our emotional pain at a cellular level, like physically in our bodies. And when you needled the elbows, it like leached out the pain of the grief that I was having over her. And I had this like little 10-minute moment with myself.
I did not even know that. You didn't even tell me.
I didn't want to I tried to not make it obvious, but I was just but I knew what was happening. I wasn't like confused, and I just let it roll, and I'm like, okay, we're just gonna do this for 10 minutes. And I have to say, it was very cathartic, and I felt much better. It surprised me because I've had dry needling, I've had acupuncture, and
I think the first time I did it was your shoulder, maybe.
And it was just insane the way like it went right to the heart of what was in my heart that day, that I wasn't even fully aware of how much it was, missing her was bothering me. On to that point, could you explain the difference, if there is one, between dry needling and acupuncture?
So there's a couple different differences between the two. And if you don't know what dry needling is, a lot of people don't. That's okay. So it's called dry needling for one, because we're not injecting anything. It is a dry, thin needle. It is the same needle you use for acupuncture. The same needles, there's different ones out there. The methodology, the method, whatever, if you will, and what we're trying to change or what we think is causing the issue is different. So a little bit Eastern versus Western medicine. Acupuncture's been around a lot longer than dry needling has. And some of the research, there's way more research on acupuncture because of that. So some of the research might be pulled from that, but what we're trying to affect is different. So with acupuncture, and again, that's not my expertise, but generally I'm trying to affect the whole body system based off of maybe this chi energy flow. I'm trying, this foot pain is because we need to release this, that, or the other, in general terms there. Whereas dry needling is more so, this muscle is our problem. I'm attacking that muscle, which is what we do, musculoskeletal, right? So I'm not trying to affect your energy, chi flow, anything like that. I'm going specifically into that area of restriction of that muscle, typically muscle, maybe a little bit of tendon in there. Sometimes there's different types of dry needling, and you'll hear trigger point or something like that a lot. And there's different types. There's active and latent. We can get all into the nitty gritty, if you will, but it doesn't always have to have that big muscle contraction, which is the active trigger point. More to the point is, you kind of felt like I was going right to the source, and that's essentially what it is. And I'm not saying one's more effective than the other without being biased, but I've seen really, really cool and incredible results, and I tend to I don't always jump to that first. It's a great tool to have, and I just find it kind of helps relieve or kind of kickstart our system a little bit better. You were not doing well when you first came in, and I was like, all right, we need to kickstart this a little bit. And it's not always just the dry needling. I think that's a great tool, and better for certain areas. There are some similarities, but there's definitely differences in just the method in what we're trying to achieve the same thing. We want this to not be painful. We want this to be functional. Mm-hmm. We just go about it differently. Yeah. Same needles though.
Massive relief.
Yeah.
And quick.
Yeah, it can be, absolutely. It's not always perfect. So sometimes, it came back a little bit right, but maybe not as significant, or maybe you had a day, 3 days, whatever relief. Usually we do it a couple times, but there's different dry needling out there too. And so anyone that's interested, always ask, your therapist. Mm-hmm. You can do a little research yourself. There's a lot out there.
But if someone has like a needle phobia, then maybe you do.
I have it all the time.
Yeah. So what are some things that you would do
So
for
if someone that has like a needle phobia, I'm not going to needle them. So I'm not forcing these needles upon anyone. I say why I think it will help them. And that's one of the first questions I ask. Are you afraid of needles? There are certain things that someone's on a blood thinner or something, I'm going to be a little bit more cautious and or not do it. Someone right after surgery, I'm not going to do it, especially around that surgical site. There are definitely precautions with that. Someone that's more scared of needles, I'm not going to needle them because they're not going to have great response. They're going to be muscle guarding. They're going to be super anxious about it. They're already afraid of needles, right? So why introduce that stress into that system? Again, I can make you feel better without the needles. There are certain situations I would love to use needles, but I don't have to. It's a tool in my tool belt. So I come across people all the time, or sometimes it's like, let's try some other stuff first. And they're like, okay, I'm ready. Like, let's try the needles. I always, more often than not, I'll bring it up on that first day or something like that. Just sometimes people need to wrap their head around it. It can become addicting, if you will, because it's a huge pain relief more often than not.
And natural.
I have had a few people that I just don't do it with because they have needle phobia. I've had one person that specifically had a needle phobia, and she now comes in and asks me to do it.
Wow.
Or when I was doing it, it kind of started out as a joke, and this was just one person. I've known her for years, for different things. Especially my kids can be a little bit more apprehensive, and they just don't know what to expect. And after that, they're open to it. They just go a needle, and I'm just explaining like how significantly smaller. Sometimes it's just showing them what it looks like. Sometimes I'll physically show them. I'll do it like maybe in my forearm or something like that. Just like, this is all it is, that kind of thing. But just letting them know like what to expect. That tends to help. And then after that's done, they're like, okay, that wasn't as bad as I thought it was at all. Someone like my girl I was telling you about that was scared of needles. It kind of started as a joke, and I just think, we were kind of running out of options, and she needed surgery, and I was trying to give her some pain relief, and I was these things weren't helping her. And it just kind of turned into, well, I think this would really help you, kind of thing. It just was like we'd laugh about, it was not pressuring by any means, but it was just, I truly thought it would help her, but I knew she was really scared of needles, and so I was, never thought it would happen. But one day she finally came to me, it's like, okay, I think I'm ready to try the needles.
Wow.
It just kind of worked up the courage to it. And we don't have to do them anymore, but she would then come in and ask me to needle. And it first started off with like, all right, let's block your vision, let's bump up some pillows so you don't have to see them. It was really more about seeing them for her.
Okay, so adjusting your head height was...
just like putting pillows on her stomach. So I was needling her hip, putting pillows on her stomach so I couldn't physically see the needles, and just letting her know where I would have to mark, like, on my little app that I was telling you about, the chart, like, this is exactly where I'm going. She just wanted to know. She wanted to know where it was going. I had to count down. All right, you ready?
Yeah.
I'm going to go ahead and, 3, 2, 1. Just so that's what she wanted, and that's what helped her.
Zero entry.
And then it turned into, like, can you needle this? Can you needle that? Can you needle... it's not that she ever got over her needle phobia. She just kind of slowly warmed up to it, and then, she saw the benefit, and that kind of outweighed for her. I would never say she loves needles, but I wouldn't go that far. But it was just, again, that was kind of more of a rare case. But typically, if someone doesn't want to, I never force that on someone.
Yeah. No, that's totally fair.
Yeah.
I think it's a very excellent point that you bring up, that the person, the whole person, because like that list we read early on, and the chronic pain of things like anxiety or grief or work. So somebody might come, but they're bringing like 5% of their game because that's what they've got that day.
Sure.
And it's great that you can adapt to that.
Yeah, and sometimes it's, I know that, like, they come in immediately and they're like, I'm just having a bad day, or I just had a stressful work call. And a lot of times you'll hear me say too, it's like, okay, let's check that at the door. We can pick it up on our way out. Let's devote some time. You made it here. Yeah. You're here. Let's be here. And, it's some of it's conversation, and some of it's like, you want to talk about it, or while we're and sometimes it's just like, all right, well, I understand. If you want to talk about it, I'm here, but there's nothing we can do about it right now. So for this next hour, let's check that at the door, okay? Yeah. And let's have a good session.
I think patients, maybe I'll just speak for myself, sometimes have a hard time doing that, because it's like, it might depend on the person, how they feel about themselves. Might feel like the problem that they're having in their life or whatever is more important or bigger or matters more than their personal well-being. And I think that's a journey we should all pay attention to. To say no, like, we're important to our health is important.
Yeah, all the time. So one, again, you're here. So you made it here. So if it wasn't important to you, you wouldn't be here. You would cancel, whatever. So you've made it here. So let's devote that time to you. Let's take this hour, and it's all about you. Another conversation I have sometimes is, you can take care of everyone else, but you've got to take care of yourself. And if you don't take care of yourself, for one, you can't take care of anyone else either. Whether that's physically and or mentally, you're there for them, and you're not any help to someone if you're not a help to yourself. So sometimes I do have to tell people, especially parents, you got to take care of yourself too. It's not always you have to be number one, but sometimes, or sometimes, like, you also have to take care of yourself. So, I do have that conversation frequently.
Yeah. It's something I think most parents probably learn the long hard way, is that oxygen mask. You got to put it on yourself, before so you can help other people. And
absolutely.
And there's something almost, selfish feeling like, I'm going to go and spend an hour on me. And
sometimes it's like, I get this hour to myself.
And other people are like skipping in there going, yes, I'm turning my phone off and nobody can reach me.
Right.
It's all types, I think, for sure. Absolutely. What are some of the myths about PT that people have? Like,
it always has to hurt. That would be the biggest one. I'm going to go in there and I'm going to hurt. It's going to be hard. I think that is one of the biggest ones. You might be able to, say more on things that you've heard or, about all of that. But I think the biggest one is just that it's physical torture, if you will. I'm not telling you it's easy by any means. Some people, hurt more than others. I think the biggest myth, and really the only myth I can think of, is just that it has to hurt. It has to be hard. It has to be difficult. All that kind of stuff. And that's not necessarily true, if you will.
Yes.
Yeah.
So if you're already hurting, you don't have to be afraid that it's just going to be worse and worse.
Exactly. Yeah,
for sure.
We're here to make you feel better, not worse.
There you go. There's the tagline right there.
That's right.
What's the long-term success of physical therapy?
I would say, pretty effective. The whole goal is for you to not have to come back with this issue. So what I find is, typically if someone's coming back for this issue, they didn't follow all the way to the end. So a lot of times the biggest thing is people get just right there and then they stop. And then a couple months later, weeks later, whatever, it comes back. And then here they are. So typically someone that kind of what we call like self-discharges themselves. And we have functional measures, certain things that we do to kind of assess where we think we are. We don't, again, just have you come in to hang out. We want you to be better, and we don't want this to come back, right? So we want to fix the issue so this doesn't continue to be a problem. It pops up here and there every once in a while, or again, maybe I'm seeing them again for a new issue. The whole goal was for that fixed and done with. So I would say it's pretty successful. There are certain things that, may not be, specific diagnoses, but again, again, you've heard it probably 10 times already. It depends. Depends on what they're coming in for, how committed they are, what they're doing outside of here. But I would say very successful, all in all.
Yeah.
Yeah.
Yeah. And I could testify to that
Yeah.
for sure. I know I'm a different person with having gone through physical therapy for different parts than having not, for sure. What would you feel is like your most rewarding thing?
I would say the most rewarding thing is obviously a patient coming in and it's like, oh my gosh, I can do this now. Or, oh my gosh, I can strap my bra on, or something. I can wipe my own butt. Like, something so little. I can shave my armpits. Like something so little to something like, I was able to hike this mountain because of you. That is obviously the most rewarding. You being able to directly impact someone doing something they couldn't have without you. Could have done it with another therapist. It's not that, but it's just it feels good, right? It
You're
feels
part
good.
of the success.
It's part of the success, and that's like why I do outpatient therapy, just because I see the struggles throughout the whole process, and I have the creativity to change it up, change different things based off of how that person is, and it could be this person has the same exact elbow pain you have, but you do better with this versus this person. So it's fun in that regard, that I have flexibility in different ways of doing different things. I mean, obviously, just getting people better feels awesome. Whether it's like they can now do something simple, like I can brush my teeth now, to where like I can do this, that, and the other. Thank you so much. It has made me a different, person. I've heard different, degrees of it, and I don't have to have someone thank me to feel good, about something. When someone comes in and says, I feel a little bit better. And I'm like, okay, well, don't say that too loud. I don't want anyone to hear that you're feeling better. I don't want you, I know you don't want to admit that, but just, knowing something that I've done, and not necessarily what I've done, but kind of steered you towards, because I'm not doing anything. You're the one doing it. I'm just kind of helping guide you. Just feels, just like it feels good to be right sometimes, or it feels good to like, have someone have those positive results, because you obviously don't want someone hurting and miserable, and that affects, for someone with it affects you, especially when you can't help that person. You want to do everything, and that sometimes that's just getting you to the person that can help you. That's it's not passing them off. It's just like that's just the right thing to do. That feels just as good as someone that can climb that mountain too. So.
When I had the shoulder surgery, I was talking to a couple that he was just going through that. He had just had it, like he was still in the sling and all of that. And I was like, so you're going to do your physical therapy? And he's like, I don't really believe in that stuff. And I said, I said, well, let me just tell you. And I took my hand out, it was cold. I took my hand out of my pocket and I raised my arm like straight up over my head. And I said, that would not be possible without physical therapy. I remember after the surgery, like the first time you go to wash your hair and like to raise your arm, and I just wept in the shower. And then it's in who that shoulder is today is that surgery never happened.
Right.
Like the problem never happened. Right. And I said, well, I'm just going to tell you what the physical therapist told me is whatever your range of motion is after surgery, if you do not work on that, that is going to be your range of motion forever.
There's kind of a timetable. How much range you can get. And a lot of it's like you just don't know what to expect. Like you don't know what's normal, how to progress, all this kind of stuff. It's our job, obviously, or we wouldn't be there. Again, sometimes it's just they don't know. They don't know what physical therapy is. They didn't have someone tell them that they needed physical therapy. I'm sure it happens way more than we think, but it takes, people like you that just put a little bug in their ear of like, this is what it is. This is how it can help you. It's take it or leave it. But I think some people just don't truly know.
Yeah, I told them, they had 4 little kids. I said, so do you ever want to be able to like throw your kids over, up over your head again? Do you want to have, any pain giving them a bath.
Well, the thing is, you went through the whole surgery. Let's make it effective, right? So the surgery fixed maybe the tear of the issue, but it doesn't fix your range of motion. No, that's one of the biggest misconceptions. Let's say specifically arthritis. Let's say like a knee replacement or something like that. Well, they went in there and they fixed their arthritis. There's no more arthritis, but your range of motion is still bad. Your strength is still bad. You still have pain. You're walking, and people think because they fixed it, it should just be better, and that's just not how it works. However long you are going, having these issues, that doesn't fix the flexibility, that doesn't fix the strength, doesn't do it. It just fixes the arthritis, and that's it. To allow you to kind of go past that stuff, but that's what people don't understand. I think setting those expectations, and sometimes that's all it takes, and then next time they have something come up, they're like, I need to go to physical therapy because I know it works,
Yes.
So.
Well, and when we don't have full range of motion or flexibility, now we're start limiting what we're doing.
And putting more strain on the muscles. And,
Either we force it and then we hurt later, or we start saying, oh, I can't or I shouldn't. And next thing you know, we're like living a life that's not what we wanted.
Not functional. Right. And you start to overuse the other side maybe because, Again, we can come full circle. I think this is how we started our conversation. So
it's so true.
Yeah.
So as we start to wrap up here, so what would you say to someone who has listened to what you've had to say today, which has been excellent advice? What would you say to someone thinking about it, whether they know they have an upcoming surgery or the chronic issue or whatever, just been like, well, I really never thought about doing it before, but maybe. So what would you tell them?
So what I would say is if you have any questions whatsoever, you can always reach out to me or any physical therapist in general. Let's say you're going to have surgery. Write down questions as you think about them. Ask all those questions. You are not bothering that person to ask them questions. Even if they feel, they seem like they're short, they're in and out, whatever, ask your questions. You have every right, and that is their job. They're here to answer. If you have any, can this help? Can I do this? What do I expect? Okay, we have people all the time. They're like, I'm going to have this surgery coming up. What should I be doing beforehand? What do I need to have? What should I come to physical therapy and when? All those types of questions. We have people that call in all the time, and we just call and chat with them a little bit. Just talk them through what to expect and just help answer any questions that they have. So that is always an option. That would probably be the best thing. But there's just so much out there, resources out there, that podcasts out there, physical therapy centered in general, just ask questions. So
could you give us a few more examples of questions if someone wanted to ask?
Types of questions to ask or how to, okay. So things such as, would physical therapy be appropriate for me? I'm having this, or who's a good surgeon to go see for this? I have this coming up. What types of things do I need to be prepared for? Like, what do I need? Whether that be ice machine, assistive devices, shower, certain things that will make their life easier for, an upcoming surgery. That would be
great.
Common questions to ask for sure. We'll ask all the time, like, oh, does my insurance cover all that? Okay, let me have you talk to our front desk staff. Any questions at all that you have, whether it's appropriate for you, what to expect. Some of that is like, all right, how long will this take? It's like, all right, we got to take a look at you first and see what you got going on. And we'll always be upfront, honest with that stuff as well. Any question that you can think of, don't be afraid to ask. That does not bother us. We can absolutely answer those questions. We feel like we don't truly know, maybe we can point you in the direction that can. So whether that's other resources or just ways that we can help you in general. Yeah. So literally there's no question that's irrelevant, I guess you could say.
Well, you guys are definitely a wealth of information, really. Yeah. It's like I sometimes think, I wish I had all that knowledge of a physical therapist in my head about like, oh, if something feels a little weird today, I'm going to do these exercises. It would be so cool just to know all that.
I'm going to tell you right now, there's only so much knowledge you can fit in this. I've forgotten all my other, civics information and everything else. So,
it's okay. You're focused, and that's what we want.
If someone can teach me, finance, business, hey, I'm all ears as well. So, it goes both ways. But it is quite the tool to have for sure.
And having an open line of communication to ask those questions is really, really helpful. Really great.
Absolutely.
Yeah. How can someone contact you?
The best way to contact me is my email address, especially if it's, any questions work related. That would be Ashlee, ASHLEE, @architect, just not spelled like the architect, as in building things. It is AR. Well, I'm gonna have to write this out. Where it is ARCHITECH. Architectsports.com. So again, that's Ashlee at architectsports.com.
All right, we'll put that in the show notes.
That's the best way, and you can always give us a call at our main line, and they can always put you in contact with me as well if phone's just easier to talk about. And that could be, you email me, hey, I have some questions about this. If you have a good time, here's my number, you can call me, that kind of thing. Both are open for communication. So, but I work in the specific the Blakeney location, but we have 5 all over, going all the way up to University, Cornelius, Mooresville area, Indian Trail. We have Pineville. We have one in the Valentine area as well. Hopefully I'm not forgetting. Oh, Baxter. We have them all over the place. So know that that's open for you if Blakeney's not closest. Doesn't matter the state. There's someone out there for sure.
Yeah. Thank you so much
Absolutely.
for your time today, and I hope that listeners will continue to ponder the mind and body and spirit connection of when you're in physical pain. Yes, there can be solutions for it, and maybe what are some of those root causes of it, and if it's a physical root cause, track that down and get to the bottom of that, and if it's a mental or an emotional cause, please consider that as well and seek the appropriate help for that, because when we're living a pain-free life, we can live in freedom, and joy increases. And wouldn't you say, like, a pain-free life is just going to make your whole day pretty much better?
Absolutely. Pain just can be so debilitating in many different ways. So, and if you don't know how to get you there, someone does. So someone will eventually point you to the right person. Maybe that takes this person to this person to this person. They'll get you there. Just keep asking.
Just keep asking.
Just keep asking.
And don't give up on yourself or on
Absolutely.
the hope of progress. That just keep pounding. Keep doing it.
Absolutely.
Thanks again, Ashlee, for your time.
No
it has
problem.
been so
Anytime.
fun.
I enjoyed it. I'm as you can see, I'm a little bit passionate about physical therapy. So any way I can extend the reach, just help people understand.
Yeah.
More than willing to.
Well, I've learned a lot today, and I know everyone else listening has too.
Wonderful.
So thanks again for all the listeners, and we'll see you next time. The information provided in this podcast is for educational and informational purposes only. It should not be construed as medical advice or a substitute for medical advice. Thanks again for listening to Real Deep Stuff. Follow and subscribe to save your seat at the table for the next conversation. Also, check out our Facebook page to continue the conversation on today's topic. We'll see you there.